Extract 1. Questions 1 to 12. You hear an emergency doctor talking to a patient called Penny Rawford. For questions 1 to 12, complete the notes with a word or short phrase. Mrs. Rawford? So, I understand you've been brought in here because you fainted at work.
That's right.
Can you tell me a bit about it?
Well, I can't really remember much. I was sitting at my desk and I suddenly got this really awful headache. My head felt like someone had fired a bullet into it. I've never had anything like it. I mean, I've had headaches before, but nothing serious. And this one was different because it was just in one place in my forehead here. And I can't remember what happened then, but my colleague sitting at the next desk, she saw me and she says I collapsed onto my desk. So she came over to help, but she says she couldn't wake me up and I was out for quite a few minutes. But I wasn't still. She says I was jerking, but I can't remember any of it. Apparently they called an ambulance and I do remember the paramedics arriving and I was able to answer some of their questions, even though I was still feeling a bit groggy. They asked me if I'd had any sort of trauma before I fainted, but I hadn't. I'd woken up as normal and cycled into work. Nothing unusual. Oh, and they also wanted to know if I'd taken any recreational drugs, but I wouldn't ever touch anything like that. I don't even drink alcohol. But they did ask me if I'd had any incontinence when I was unconscious, and I found that I'd leaked a bit of urine. I was ever so embarrassed, but they were quite okay about it. I suppose they're used to it. And once they'd got me into the ambulance, I felt really awful. I had this nausea, but they gave me something for it. It's not so bad now.
Oh, that's good. So, how's your health been generally in the past? Have you ever had anything like this before?
No, not really. I did go to the doctor a few years ago when I had some stomach pains. They did an endoscopy, but everything was normal and I've been fine since then. I'm usually quite healthy, all my family are. I've only ever had one operation, and that was a few years back now, in 2014. It was just after I'd had my third child. I had to have a hysterectomy, but I've been fine since then. Oh, there was something about a year later. It must have been 2015. I'd been putting on a bit of weight and I thought it was because of the operation, but I've been feeling a bit tired as well and getting these cramps at night. The doctors did some tests because they thought I might have an underactive thyroid, but it was okay. I think maybe I'd just been overdoing it a bit.
Oh, that's excellent. Well, how do you feel now? It looks as if you've got a bit of bruising there on your face.
Yes, and I think I've got a cut there too, a little one under my eye. That must be where I fell on my desk. I've still got a bit of a headache, but nothing like as bad as it was. I do feel as if my neck's a little stiff, but that might be because I've been lying down. And the paramedics asked me lots of questions to see if I had anything funny with my vision, but that's all okay.
Great. So, now I'd like
Extract 2, questions 13 to 24. You hear a physician talking to a patient called Mrs. Gregorius. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Mrs. Gregorius. Be seated. Tell me what your problem is.
Good morning, doctor. I'm having severe abdominal pain and nausea after eating.
What's your age?
38, doctor. I'm intolerant to fatty foods and my urine is dark colored.
Do you get fever?
Yes, I get chills and low-grade fever, nausea, and a sharp stabbing pain in my abdomen. But when I lie down on my right side, I feel somewhat relieved.
How long have you been suffering with these problems?
For the past 3 months, doctor.
Have you had any surgery before or any diseases?
No, doctor.
Are you taking any medications?
No, doctor.
Are you allergic to any medicine?
No.
Do you smoke or drink?
I do smoke 1 pack a day, but I never drink.
Do any of your family members have a history of any diseases?
No, doctor.
Tell me something about your family background.
I am married and living with my husband and 2 children.
Do you have any symptoms of seizures and ataxia?
Yes, doctor, I have.
Well, your MRI report is positive for cholelithiasis without CVD obstruction. Laboratory studies show that you have elevated bilirubin and elevated white blood cells. Your heart rate and rhythm is regular without any murmur or gallop. Bowel sounds are of a high pitch. Lower extremities are normal in color, touch, and temperature. No ischemic changes are noted. Range of motion is normal. You have developed gallbladder disease. I would suggest laparoscopic cholecystectomy with intraoperative cholangiogram.
Okay, doctor.
Part B. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare environment. For questions from 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at question number 25. Question 25, you hear 2 doctors having a discussion about chemotherapy for bladder cancer. Now read the question.
Doctor, could chemotherapy inside the bladder reduce recurrence of cancer?
According to a recent study, patients who had the chemotherapy drug gemcitabine placed inside their bladder following the resection of the tumor had fewer recurrences. Out of more than 400 subjects, 384 completed the trials and were included in the study, which randomized them to receive the chemotherapy drug called gemcitabine. To treat the bladder cancer, they implanted it into the bladder and let it settle there for an hour, and the other group with saline without gemcitabine in it. They kept the patients under observance for every 3 months for 2 years, thereafter every 6 months for another couple of years. What they observed was the recurrence were 34% less. The purpose of this study was to prevent bladder cancer from invading the muscle wall of the organ. Moreover, this is a very simple method without any significant side effects. Question 27. You hear 2 doctors discussing occupational therapy for improving visual function. Now read the question.
Doctor, can visual function be improved through occupational therapy?
Well, findings proved that occupational therapy for patients with poor vision performed at their home and directed particularly toward helping them with both meaningful and challenging tasks, helped avoiding depression that actually improved the visual function as well. It was observed that those with milder visual impairment actually performed much better on these questionnaires after the occupational therapy group, whereas those who were in the supportive therapy attention control group could not improve their visual function measures. Therefore, the occupational therapy role not only improved in some of these depressive symptoms, but also in this specific subset of patients with mild impairment did improve their visual function as well. The comprehensive approach to rehabilitation, including in-home occupational therapy for those with visual impairment, is the key to improving visual function. Question 28. You hear two doctors talking about why primary doctors should not perform eye screening. Now read the question.
Doctor, why shouldn't the primary care doctor perform eye screening of the patients?
Well, according to the recent recommendations of the United States Preventive Service Task Force, the primary care doctor shouldn't include a vision screening to the list of primary tests for his patient in his office. To know why vision screenings may not trace out the precise vision impairment, we need to look at the factors that can restrict the effectiveness of the results. Many vision screenings are performed only for distance visual acuity, and it does not give any indication of how well the eyes work together or focus up close. It also does not give any detail about the eye health. Although certain screenings may include a plus lens test for farsightedness and eye coordination tests, even these screenings will often fail to detect many vision defectiveness. Often, a vision screening is conducted by primary doctors or administrative personnel who have little training, who haven't the complete knowledge to assess screening results. Even if the screenings are performed in pediatricians or primary care physician's office, the scope of vision screening may be restricted by the type of lab equipment. Question 29. You hear two doctors discussing dysphagia after the use of breathing tubes in ICU patients. Now read the question.
Hello, doctor. Is trouble with swallowing common following use of breathing tube?
Breathing tubes are meant to save lives, and they are often used for critically ill patients as well as during various surgeries. However, using breathing tubes has a side effect of difficulty in swallowing called dysphagia. In the ICU, patients had breathing tubes down their throat, typically more than 48 hours, will have a minor difficulty of swallowing and some voice problem as the tube is pulled. If it becomes worse, it can last years afterwards. According to the findings, most patients in this 5-year study recovered from their dysphagia within 6 months. However, there are also cases of the condition lasting up to 5 years. The good news is that even in patients with the prolonged periods of dysphagia, ultimately they did recover some function. Question 30. You hear two doctors talking about risk factors for kidney donors. Now read the question.
Doctor, how risky is donating one of our kidneys?
Well, there is an online risk tool to calculate the long-term risk of end-stage renal disease in people who are willing to offer kidney donation. This tool includes many characteristics in contrary to single characteristics used earlier. This multitude of characteristics help develop a comprehensive picture of risk in donating a kidney. This tool incorporates 10 different characteristics that are specific to the person willing to be a donor and provides an estimation of the absolute risk of end-stage renal disease over a certain period of time, say 15 years.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best, according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You will hear an interview with a sports injury specialist called Toby Walsh on the subject of hamstring injuries. You now have 90 seconds to read questions 31 to 36.
My guest today is a sports injury specialist called Toby Walsh. We're going to be talking about hamstring injuries. Toby, hamstring injuries are something sports people at all levels of ability fear getting. Why is this?
Well, you're right. Hamstrings are the most significant injury in a number of team sports, including football and rugby, but any sports person could be affected. I think, looking at the statistics, hamstring injuries account for the largest number of lost playing hours amongst professional footballers, even though the average injury only takes about 3 weeks to heal. More worrying for the individual is that once they've had such an injury, The chance of sustaining another one in the same season is as high as 20%, so it can become the thorn in the player's side. That, I think, accounts for the reputation the injury has.
So is this an injury that can affect any of us at any time?
Well, the hamstrings are a group of muscles in the thigh that allow us to bend our legs and knees effectively. Now, some ethnic groups are more predisposed to these injuries than others, and everyone's chance of tearing the muscle increases with age. But apart from that, they're generally the result of short bursts of movement, like sprinting or suddenly changing direction, and they happen more in certain sports because these are just the sort of movements that players are making. They happen most often at the end of what we call the swing phase of running, just before the outstretched leg hits the ground and the muscles contract to bend the knee.
But I'm sure there are ways to prevent these injuries.
Well, looking after the muscles themselves obviously helps here. You can do various exercises that actually strengthen the hamstrings and so make them less prone to injury. And of course, warming up before exercise is crucial in avoiding all sorts of muscle strains, and sports people know that. But that isn't the whole story. One interesting finding is that a lot of people who develop hamstring injuries have coexisting back problems, and there would seem to be a correlation. By loosening up the lower back, you also help the nerves that control the hamstring. Flexibility there allows the muscles to function as they should, and there are exercises people can do to help that.
And is the risk of hamstring injury something that should be taken into account in training programs?
Well, yes. Intensive training, of the sort you do for team sports like football, can put quite a heavy workload on the gluteal muscles, which can lead to a tightening around the hips, creating knots known as trigger points. These, in turn, can cause referred pain in the hamstring, reducing flexibility and increasing the risk of straining or tearing it. I mean, basic stretching exercises can help here, but also we know that muscles are more likely to strain if they're fatigued. Often, during a period of intensive training, you get cumulative fatigue. This can creep up on an athlete, on their muscular system over a number of weeks as the training intensifies.
And if an athlete does pull a hamstring, how can the sports injury specialist help?
Well, they'll feel the pain, maybe even feel a pop, and they won't be able to continue because the muscle will go into cramp and spasm. There are 3 degrees of severity, and the treatment will vary according to that. Fortunately, as a sports injury specialist, you're often present when the injury occurs, or you can see it on video, so you don't have to rely on a verbal account of symptoms to assess the severity. Initially, you want to stop any swelling as soon as possible. That's your priority. You're going to apply compression bandages and possibly ice. Although there's some debate about that these days, it does ease the discomfort. And you'll certainly elevate the leg and make sure the patient rests up.
And how long will the athlete be out of action?
Well, as I say, that's going to depend on the severity of the injury. They'll have to rest up for 72 hours, whatever happens, to avoid causing further damage. And things like heat and massage can be just as damaging as movement itself.
Oh.
A grade 3 injury can take months to heal and can be career-threatening for top athletes. What's more, lack of use can lead to the development of scar tissue and muscle shrinkage. In other words, the muscles won't return to their former state, even if the tear or strain itself heals. So part of my job is to ensure that doesn't happen by getting the muscles working again in the right way as soon as possible.
Now look at Extract 2, questions 37 to 42. You hear the monologue of a physician giving a lecture on acanthamoeba infection. You have 90 seconds to read questions 37 to 42.
Hello, doctor. What is an acanthamoeba infection, and what are its types?
Acanthamoeba is a genus of opportunistic protozoan amoebic species widely found in the environment. Moreover, it is part of a broader family of free-living amoebae that can autonomously survive in the environment. However, it can also parasitize in humans and result in severe infections. Having discovered as a contaminant of yeast culture in 1930, it has become increasingly appreciated in the past few decades due to its potential to cause diseases in persons wearing contact lenses and immunocompromised persons, and also for its capability to act as a reservoir for various pathogens such as fungi, bacteria, and viruses. Three major classifications of rare clinical syndromes can be caused by acanthamoeba. A fatal granulomatous amoebic encephalitis that involves the spinal cord and brain, acanthamoeba keratitis that involves the eye and disseminated infection that often manifests in many skin lesions. Granulomatous amoebic encephalitis. Initially, the term granulomatous amoebic encephalitis was coined mainly to define the brain infection caused by acanthamoeba species. Nevertheless, the other free-living amoebae, especially Balamuthia mandrillaris and Sapina diploidea, can result in analogous clinical presentation. Most often, acanthamoeba affects the posterior structures of the brain in patients' diseases such as diabetes, renal failure, various malignancies, systemic lupus erythematosus, and human immunodeficiency virus. Other predisposing factors are organ transplantation, drug abuse, alcoholism, radiotherapy, or chemotherapy. It is often very cumbersome for the early clinical diagnosis of this condition, as symptoms mimic ischemic stroke or some other type of infectious encephalitis. In this condition, the disease usually manifests with headache, confusion, stiff neck, fever, lethargy, and focal neurologic deficits. As the infection becomes severe, the signs of raised intracranial pressure predominate, resulting in coma and mortality. Acanthamoeba keratitis represents a multifactorial process connected with the use of contact lenses. It can also occur in non-contact lens users, especially those with low levels of immunoglobulin A antibodies in their tear film or changes in the surface of the cornea. The process begins with the disintegration of the epithelial barrier and stromal invasion by acanthamoeba that induces a vigorous inflammatory response and subsequent stromal necrosis, with potential blinding. There is also a chance of bacterial superinfection that further complicates timely diagnosis. Usually, the symptoms are restricted to one eye and include swelling, pain, redness, tearing, light sensitivity or photophobia, abnormal contraction of the eyelid called blepharospasm, and blurred vision when the corneal lesion involves the visual axis. Disseminated infection and skin lesions. If acanthamoeba enters the skin through the nostrils or a wound, the organism can travel through the bloodstream, spread to other organs, and result in a disseminated infection. In such cases, the clinical process can be fulminant with swift progression to death. Infection with acanthamoeba species can also result in various skin lesions that usually start as firm papules nodules, subsequently developing into indurated ulcerations. Yet it is unclear whether such skin manifestations arise as a primary focus of infection or as a result of hematogenous spread from other sites. If they are diagnosed microscopically, the cutaneous lesions are often characterized by focal necrosis surrounded by inflammatory cells, vasculitis, and amoebas themselves. Even then, the condition can be confused with other infection caused by fungi, viruses, or mycobacteria, especially if the organism is not visualized in the single biopsy specimen. This is the end of Part C. You now have 2 minutes to check your answers.